Hi class. So we're continuing the discussion with the next counseling theory on our list, and we are moving now into Gestalt therapy. So Gestalt therapy is really focused in on holism, right? To try and incorporate all that we are instead of focusing in on one particular area, like a lot of the other theories tend to. What's fun about Gestalt therapy is really it's known for a lot of its creative interventions, its approach, the intensity that can exist within a session, and really the hard part about Gestalt therapy is summed up in a pretty good Fritz Perls quote, that you need to get out of your head and come to your senses. That there's more than just analyzing the cognitive side of things. There's more than just analysis. That we need to get out of our head and come to our senses. We need to embrace confusion. And there's a lot that happens within a Gestalt session that is really intense, that doesn't leave a cut and dry answer, but really tries to dive down into the heart of what's going on right there in that room at that moment, and really create the opportunity for you to embrace all that you are holistically. So there are four main tenets or principles guiding Gestalt therapy that we really need to focus on. So the first one is that there is power in the present. Power in the present. 2, that experience counts for everything. 3, the therapist is his own instrument. And 4, that therapy is too good to only be for the sick. So those are the four main principles that we're going to really focus through, and we'll get into some of the unique interventions that Gestalt therapy is known for. But first off, power is in the present, right? One of these first principles. And more than any other theory, Gestalt therapy focuses in on what is happening in the present moment. There's something unique in that room that is happening. That there's a present orientation through session. We don't want to report, right? We don't want to come in and report on what is happening. We don't want to give an account or refer to things that we experience. Instead, we want in that moment to focus in on what we are experiencing. We want to focus in on the here and now. And while that sounds easy to do, it is actually extremely difficult for the therapist to maintain that space, and for the client to be continually willing to walk into it as well. It's very uncomfortable present orientation. The here and now. So I've had a lot of different clients come in, and I'll even ask them what they were thinking about on the way in, or even more so, as soon as they come in, say, hi, how you doing? What's something you don't want me to ask you? What was something you were afraid I was going to ask you? Be able to dive into some of that. And why were they afraid in that moment? What are they expecting from me in response? And trying to maintain a present orientation through that conversation. And it's nerve-wracking, right? And so I had one client that on the way here, she was talking about really how she had no idea what therapy was going to be about today. She had no real issues, but she talked nonstop, without a breath, for about 40, 45 minutes. At which point, I asked her a very odd question, very strange. I said, have you entertained me enough today? And that really threw her off, because that's a really odd question, right? It's a weird thing to hear from your therapist. But I said, you've spent 45 minutes reporting to me about very interesting things that I find fascinating. So am I entertained enough to continue with you? And we explored just kind of her reaction to that. And really what came out is that through the session, what she was trying to do was entertain me, to be problematic enough, to be interesting enough as a patient, that I would want to continue scheduling sessions with her. Come to find out that she had a previous experience with the therapist where her problems weren't severe enough, they weren't significant, at least on the therapist's side, so therapy was no longer needed, and the client was left with no further sessions. We're canceling these further sessions because you clearly no longer need it. So when she came in to meet with me, what was really happening in the room is she thought that I wasn't very interesting. She thought that, so she thought that I thought she wasn't very interesting. She thought that I was going to cancel sessions with her because her problems weren't significant enough, and that she needed to play a role to keep me engaged with her, that she needed to be valid enough to be worth my time. And exploring that in the here and now, that dynamic between us was absolutely far more interesting, far more significant therapy-wise, far more beneficial for her than anything else that we probably could have focused on in that day. That here and now interaction between us, the here and now dynamic, the big elephant in the room, right? Being able to notice the elephant in the room in that present moment. What was she doing? To stay present oriented is very, very difficult. But again, there's so much benefit to that there's power in the present. Second is that experience is everything. That we don't want to simply report on what's happening cognitively. We don't want to simply go through our perspectives or just chat for a while, analyze something to death. There's something to our experience as well. And really that dives into Gestalt therapy's phenomenological approach, in that we each have unique human experiences that matter, that are valid, and are as unique as each one of us. So I can't make assumptions about their experience, that I want to instead allow for that experience to exist in the present moment and engage that. That's particularly true with Gestalt dream analysis. It's what makes Gestalt dream analysis so different than everything else. We don't want to report on a dream. We don't want to read it and analyze it, very much like Freudian psychoanalysis. With Freud, you report on the dream, and then what's important in the dream are the symbols, and then we refer those symbols back to our lexicon and determine what each one of those mean. But instead, with Gestalt therapy, what's particular about it is that the dream needs to be said in session in the first person present. And the constant question that you ask, right? You don't want to ask why, you want to ask what and how. How is that impacting you now? What are you responding to now? What are you experiencing? That's what's really important. You want them to re-experience the dream here and now in session with you, and you explore it through that avenue. Which leads to the third principle, in that the therapist is his own instrument. So this one is harder to understand until you really understand the importance of the relationship dynamic. That the most important thing happening in that session is the interaction, is the relationship. There's nothing more important in session than the relationship itself, the dynamics between the two. And if you were watching the Gloria videos with Fritz Perls, you saw that constant back and forth interaction, that the two of them together were all that was needed, and their interactions and the tensions between them. Nobody really does Gestalt therapy like Fritz Perls. He really used frustration as its own intervention, really kind of pulling the client out of their comfort zone, but very much still recognizing the dynamics between you and your patient. That really focuses in on establishing presence, right? The importance of presence in a therapy session. It's something that just Gestalt therapists have known for a long time, is that there's something to that face-to-face interaction. There's something to having a body in the room that can't be summed up with telehealth. It can't be summed up just with these YouTube videos and we're going to connect via internet. There's something to presence and being in the room together and being able to hold that presence. It's based on a philosophy that Gestalt therapists really embraced, humanists very much embraced, existentialists as well, but what's called the I-thou relationship. I and Thou is based on the philosophies of Martin Buber, who is a Jewish existentialist philosopher in Germany, very much at the same time that Fritz Perls was around in Germany as well, and probably would have been reading his work. And for obvious reasons, during the time, Fritz Perls ended up leaving Germany, and Martin Buber as well. Fritz Perls went to the U.S., and Martin Buber went off to Israel at a particular time in history. But the focus of it, the reason why that's so significant is the two of them were in the same country, having these same philosophical debates. Fritz Perls leaving psychoanalysis and going for something deeper, and Martin Buber writing about the importance of relationship. That there is a twofold nature within us. That on one hand, there is what he calls an I-it relationship. The I-it relationship is an interaction between things, right? That I am a thing, and you are a thing. You are an object that serves my purposes, or doesn't serve my purposes. But either way, I'm interacting with things. And that happens all the time. We constantly do this. The scientific method is built in the I-it world, in that we identify, we analyze, we label. And now that I've diagnosed you, I take you and I put you up on the shelf, and I know how to continue interacting with this object. And you can see that through a lot of different counseling theories, there is a clear label of who the therapist is, who the client is, and what the problem is before the client's even walked in the room, right? The world of I-it. I-thou is, well, far more complicated and far more confusing, far less certain, but it's the world of the subjective, and that there is nothing except the meeting. According to Buber, all real living is meeting. That face-to-face, present-oriented, two individuals coming together with no expectations. I'm not requiring anything of you, I'm just experiencing you. I just came here with complete disregard for what I hope to gain from you, and I'm just wanting to experience you. I'm just wanting to meet you. And that is where life is found. And obviously with his Jewish heritage, and when I read it, when I go through his works, the ultimate I-thou that he labels is the eternal thou, right? The interaction between man and God. And that every interaction between us as people is a reflection of our relationship with God. And it makes a lot of sense to me, because in Genesis, God comes in and he speaks the world into existence. And he commands it, really, right? He commands that there be light. He commands that there be separation between the earth and the water. He commands animals. But then he comes down and he draws humanity. He gets down into the dirt and he draws it. He uses his creative side. He uses his art. And he draws us down in the dirt. And then in order to bring it life, he doesn't command his art to come to life. He breathes into it. In this meeting, in this interaction. All real living is lived in that interaction. That is authentic. That's a really important part of an I-thou. There's no agenda. I'm not manipulating you. I'm not trying to really intervene. I'm just trying to experience and engage you. And that is where life is really found. That's where we come alive. It's a really awesome concept, really unique to Gestalt therapists. And one thing in particular, while Irving Yalom is an existentialist, and all of his topics focus on existentialism, really, if you read through his works, his everyday practice, his interaction with patients is far more Gestalt than it is existentialism. Well, every topic is existentialist. The way he interacts, and a big part of that is his authenticity. Now, he's very, very committed to making sure that he doesn't do what the typical therapist does, that the client asks him a question and he steps back and doesn't answer, and he says, well, why do you ask, or why is that important? The typical therapist dodge, right, where the therapist doesn't want to bring themselves into the session for fear of transference. Instead, Yalom answers the question without hesitation, 100% honestly and accurately, no dodge. And that's completely transparent, and he's bringing himself authentically into that session. Well, there might be questions later, well, there's my answer. Now, why do you ask, right? I want to start start with the premise that if I'm going to require honesty of you, that I'm going to be honest as well. If I'm going to require you to come in and meet with me, that I'm going to meet with you as well. That this is what's important in that interaction. That's the therapist as his own instrument conversation. That's the I-thou. That's that conversation of true presence and authentic interaction. And one particular principle that I absolutely love is that therapy is too good to only be for the sick. Now this really comes out of the humanistic movement, particularly the human growth movement, that there were people who just found that while there weren't problems, while there weren't symptoms, while they didn't meet a diagnosis, they wanted to grow. They wanted to learn to live. And Gestalt therapy offers that. The Gestalt therapy offers you a chance to really learn to engage your clients, the clients who engage back, to really learn how to dive into relationships, to really learn a lot about themselves in small areas that don't meet DSM-5 diagnostic criteria. And it's even Yalom who says that diagnosing exists only for the purpose of having insurance pay for your session. That other than that, we don't want to label. We want to just dive into that interaction and grow from there. And really during the 50s, 60s, 70s, there was such a hunger for an opportunity to grow as a person. And instead of simply doing triage therapy like so much of our world today, insurance has come in, and I don't get a lot of this. Insurance tends to be fairly good, but a lot of different programming, and there are a lot of insurances that want to limit the number of covered sessions because they want triage. They want to see you come in with some symptoms and a diagnosis and leave as quickly as possible with no diagnosis, with no symptoms. And that's not always necessarily healthy. One interaction I had with a client, we started out actually with EMDR, and she was making a lot of progress working on her trauma. It was amazing. And at the end of one particular session, I get that this may be inappropriate according to some other of my colleagues, but I turned to my client and I said, you're making a lot of progress and this is absolutely amazing. And she was thrilled. And I said, one fear that I have is that we clear the road of all the junk and then you leave. And we don't actually get to travel this road together. And what a shame that would be, to miss the opportunity to grow together. Now, some people really look at that as, well, I just want to try and hold on to this client for forever and continue paying my bills. But no, it's far from the point at all. That sometimes we only focus in on just clearing the junk, just going in and triaging, throwing a cast on it, making it so that you can walk and kind of moving on your way, but really not growing and learning. There's one particular example of a really subtle way in which a person through Gestalt therapy learns so much about herself. And again, it doesn't meet a diagnostic criteria. It's this woman who really struggled in creating lasting, significant, deep relationships. And in fact, she really frustrated a lot of the people around her. And during one particular session, she was asking her therapist, if I'm not mistaken, that she just wanted to reschedule a session. Something that happens all the time, and if there's availability, rescheduling, that's perfectly fine, right? No big deal. But the therapist responded just with frustration, and he just was authentic in his expression, and just was like, "Stop manipulating me." And the client was thrown back. And what do you mean manipulate you? I don't get it. I was just asking if I could change. And the therapist said, "Well, I noticed that when you asked me, you tilted your head and kind of looked up and kind of shrugged at me. If you do that here, how many other places do you do that?" And as they continue diving into that conversation, and that simple behaviorism, just can we change our session, please? She had learned at such a young age that she could really get her dad to do whatever she wanted by putting on a cutesy face. She would look at him with her puppy dog eyes, and she would tilt her head, and his heart would melt, and he would give her whatever she wanted. Well, she continued doing that, and as a grown woman in a professional environment, that frustrated people. People don't like feeling manipulated, generally speaking. And it was not her intentionally manipulating, but it definitely felt that way. So through those interactions, through the authentic response from the therapist, they were able to look at these behaviors and see how she's manipulating behaviors, how she's manipulating others' behaviors, and the way that she's interacting, and how that impacts their relationships. And really, again, that through all of these, through power in the present, through experience, through the therapist as his own instrument, and therapy is too good to only be for the sick. What we really get to see is Gestalt therapy's focus in on trying to make contact, right? Far more important than coming up with a brilliant analysis, brilliant interpretation, like Freud would say. It is making contact with your client. Really being able to have that I-thou interaction, present-oriented, to make contact with them. And you definitely see, especially after the session, Fritz Perls talking about how he thought that session went. And you can see it was nice to finally meet you. It's something that comes up through that video. So while there's a lot of different options available for intervention-wise in Gestalt therapy, I want to focus just on 3. And what makes Gestalt therapy so fun is, for one, there really aren't any interventions. That's the wrong word, right? We don't talk about using interventions because that's manipulation. I have an intended goal. I'm trying to intervene and get you to my goal, and that's not what Gestalt therapy is all about. Instead, we have experiments. I have no idea where this is going to end, but let's go on this journey together. Let's try something. Let's shake it up, and let's see where we can go. There are a few assumptions along the way, of course, but we really want to avoid assumptions as much as possible. So, and with that, with the idea of experiments, there's no limit to what we could be doing, as long as we are present-oriented, as long as we are really engaging that client, really making contact. Just the sky's the limit in what we can do. We can be as creative as possible. Again, it's something that I love that Irving Yalom said, that with each client we need to create a new therapy. That every problem and every intervention and every solution needs to be as unique as the person in front of you. So we're not going to take a cookie cutter program. We're not going to take these protocols and just assign them to the patient and hope that the patient fits the protocol. We're going to create a protocol with the client that fits the client. Makes therapy very unexpected and very, very fun. It also makes group therapy really fun too, because you don't walk in with a lecture ready. You walk in just experiencing what's happening in that session. It's very unique, and very much can be intense. So again, a couple experiments that are really popular with Gestalt therapy. One is a simple conversation of top dog. So again, Fritz Perls in Germany was very politically active and remained there until it was dangerous to remain there. And he eventually makes his way out to San Francisco. Well, he begins thinking about his own inner critic. He begins thinking about that self-talk in his head. And he begins thinking, well, I remember something like this. That in Germany there was one person with a microphone. There was one person able to speak. And I saw what kind of devastation that happened when other voices weren't allowed. And he really renames this inner dictator top dog, right? When there is a top dog voice and nothing else is allowed, bad things happen. And I think that's very understandable. So, so instead, beginning to ask, are there any other voices, right? Here's what Top Dog said. And Top Dog has a seat at the table, but if I can create an egalitarian government inside my head, instead of a totalitarian, instead of a dictatorship, I can create the Knights of the Round Table inside my head. Top Dog is just one seat. Now, he deserves his place and he has his seat, but are there any other voices? Is there an underdog? Is there a rebel? Is there, well, a lot of different things, right? The sky's the limit. Are there any other voices in my head? And it sounds so simple, but it's quite amazing once you realize that Top Dog isn't the only truth that's possible, that there are other voices. And so very practically, a lot of my clients that struggle with that inner critic, that inner critic is very loud and almost always very, not just critical, but condemning and torturous. I think torturous is an appropriate word. To recognize that there's more than one voice that they are able to listen to. And one way of drawing that out is simply by pointing in the obvious, the elephant in the room. Well, according to Top Dog, right, according to your inner dictator, you don't deserve to be alive. You don't deserve to be better. No one cares about you. You shouldn't care about yourself. You're worthless, and the list goes on and on and on. And I can say, well, obvious elephant in the room, why are you here in my room? Why are you here? For one client in particular, if you don't deserve to live, why did you check yourself into an inpatient facility? And then after that, follow up with the aftercare recommendations and come to my office and engage in weekly therapy and be honest and open and really challenge yourself and grow. And why are you practicing coping skills outside of this room? Why would you do any of that if there's only one voice? Maybe you showing up here and now is representative of the other voice. At least one other that says, I deserve to get better. There's another voice there. At least one, if not many others. And that's really hard for clients to wrap their heads around, but you can see when that first clicks. Because they realize, I don't have to listen to Top Dog. I can listen to something else. It's a really cool experiment that you can use in a lot of different ways. There's so much room to play with that. Another one that is probably Gestalt therapy is most famous for is the empty chair. Empty chair is exactly what it sounds like, that you're interacting with a client and they need to say something, particularly to another person, but that person's not here, right? Or maybe they're dead. Maybe they have no idea where they are. It's an ex-boyfriend from years and years ago, and you can't even find them on Facebook. You don't know where they live. You can't finish this. It's unresolved. There's this unfinished business that you need to tend to. And I've even incorporated this with EMDR as it's come up through their reprocessing. Something just needs to be said. And maybe it's inappropriate to say, right? Maybe it would just cause conflict. Or maybe we know that if we had that interaction with the other person, it would be unsatisfactory. They would respond back with excuse after excuse or however, right? Or more condemnation. So I grab a chair and I just pull a chair over, and you can see in the background I've got a nice little circle of chairs, and at some point I've used all of them. I've thrown some aside and let's just do one-on-one with this empty chair, or I've pulled all of them and I had them create their committee, or I've had them interact with the whole family at one time. Finish your unfinished business with the whole family. It's just you and them, and man, there's so much that happens through those interactions. I've had them finish unfinished business with themselves, to throw maybe their inner child, right? Almost kind of doing parts work, and throwing their inner child into that other chair. It's really fun to be able to flip that too. Your inner child is in that chair. Don't be the adult speaking to the inner child. Give your inner child a voice to speak to you. What are they saying right now? Man, there's so much that can happen in that. But again, it's focused in on this idea that there is unfinished business that has to be resolved. The empty chair gives you the opportunity to do that. And again, in so much of a variety of ways. Most people, they start with not feeling comfortable with role play, that it seems silly. They're not here, it's empty, and it's amazing how 30 seconds later they can be completely engrossed in it. They can just be absolutely not role playing, but really living it out. Obviously a big idea is that I don't need the other person to finish my business. The problem is internal, that I need to resolve this within myself. Another one that's really fun is a simple quote. Give your clenched fist a voice. Now obviously it's more than just a fist, but when a client is, I don't know, and I said, okay, well, give your clenched fists a voice. Or far more often what I actually use is when they're crying, I really don't like having tissues. I do have tissues. For the longest time I didn't, especially with current situation. I have tissues and hand sanitizer, but I really didn't want them to grab a tissue and stop the tears. I really didn't want that. What you see is an immediate shutdown of that experience, of that processing, of that exploration of themselves. It just immediately shuts that down, and they go right back into reporting mode. They stay out of that present orientation. So what I want them to do as they're crying, I say, no, don't wipe your tears away, especially with women if they have eye makeup on or whatever. I tell them, we're not on a date right now. Let the makeup run. It's fine. You can clean yourself up later. Let yourself cry. Let yourself experience. Stay in this moment, for one, right? There's power in the present. But then I tell them, give your tears a voice. And it's amazing what comes out from that. What are your tears trying to say? Give your clenched fist a voice. And you can do that with anything. Oh, I know, we just go through this. I just feel this pit in my stomach. And say, okay, well, what is your stomach trying to say? What's it saying right now? Listen to it. What's happening right now? It's amazing what starts coming up. Being able to explore that. And again, listening to everything, being very holistic, mentally and emotionally and physically, relationally, what's happening in the room. To be able to incorporate all of that. One final thing, it's kind of a fun game. It sounds silly until you try and play it, but one little trick to kind of test your present orientation is I see, I feel, I imagine. Just fill in the rest of the sentence, right? And do this with somebody else, out loud. I see, I feel, I imagine. And you can really test yourself and test somebody else. See how present-oriented they are. The temptation is that you answer in a lack of present orientation. I see it's going to be a beautiful day. No, you don't. You don't see that right now. Like right now, I see the iPad in front of me that I'm recording this message on. I see myself really talking with my hands. I feel silly for talking with my hands. I feel silly that I'm trying to be present-oriented with a recording. And I imagine that I am coming across very silly right now. I've done this with other people before, and they say, well, I see it's going to be a beautiful day. And no, you don't. I feel like this is going to be a helpful test. No, that doesn't sound right either. And they say, I imagine the book that I'm reading. So are you really right now, as we're talking, imagining the book? No, probably not, right? I see you in front of me. I see the iPad in front of me, because that's actually what is happening to me right now, is I see the iPad that I'm recording this on. I feel a little enthusiastic right now. I feel a surge of energy right now. I feel almost at a loss for words. Like I imagine you think I'm rambling. Am I willing to, in the moment, give you my unprocessed thoughts? No editing required, right? No Photoshop required for my thoughts, for my experiences. But what we do a lot of times is we're not present-oriented because we're cleaning it up all along the way. We're only giving what is presentable instead of in the true present orientation that we are really engaging in unphotoshopped experience and just meeting together. There's so much fun. There's so much more to this. If you have not watched the Gloria video, please jump on that. And I hope you guys stay safe, stay healthy. And the next conversation will be about Carl Rogers and person-centered therapy. Hope you have a great night. Bye.